It's called what?
The
The parietal pericardium. The surface of the heart here is called what?
Visceral.
Visceral pericardium. Okay, or epicardium. Epicardium. So orientation here is important. Unfortunately, we don't have a real prominent anterior interventricular or left anterior descending coronary artery. But based on experience, I would expect that it would be right in this region right here. So that would tell us that this side is the right ventricle, this side is the left ventricle. Okay, apex, base. Okay, so the first thing you're going to look for are the atria. Right atrium, left atrium. Notice the right atrium's a little more exposed than the left because the heart's rolled a little bit. What is this little tag here called? The auricle. Remember the dog ear? So that's called the auricle of the atrium. Similarly, on the left side, this dog ear here, auricle. Okay. What's the purpose of the auricle?
increase blood volume.
Thank you. Increased volume. That's strictly what it. That's all it does. All right. So now we have identified right ventricle, left ventricle, right atrium, left atrium, and the auricles. We've identified the apex and the base. Remember the fat tag I always told you about?
The aorta.
Look for the little fat tag. That's the aorta. But remember in the heart anatomy, the aorta is not the most anterior major vessel on the base of the heart. What is the most anterior trunk leaving the heart? Pulmonary artery or pulmonary trunk. Remember, pulmonary artery carries what kind of blood?
Deoxygenated.
Deoxygenated blood. Why? Because it's transporting blood. We define arteries and veins how?
By the
Blood flow. Veins bring blood back to the heart. Arteries take blood away from the heart. It has nothing to do with oxygen levels. Okay, so that's why we call this the pulmonary trunk of pulmonary artery. So very inconspicuous here. The most anterior structure coming out of the right ventricle right here. Pulmonary trunk. See that? Okay, you're not going to see it very well. But note that you have a splitting of the pulmonary trunk here. So you have the left pulmonary artery here. This is the hilum of the lungs right here on this little indentation area here where the bronchi, arteries and veins enter and so forth. That's called the hilum, as is this area right here. So we have over here, we have our left pulmonary artery. We roll this way. We might be able to see in this region right in here, somewhere right in here should be the left pulmonary, right pulmonary artery. But you also remember you have the trachea coming down. The trachea bifurcates into what's, well, I haven't taught you this yet, but where the trachea bifurcates into right and the left main stem bronchi is called a carina, C-A-R-I-N-A. Okay? And so the right and the left main stem bronchi enter the hilum of the both lungs right with the pulmonary arteries, right and left pulmonary arteries. So right main stem bronchus, left main stem bronchus are going to be entering into the hilum of the lung together with the right and left pulmonary arteries. Okay? So moving on, the next major trunk you're going to find behind the pulmonary trunk, or the main pulmonary artery, is what? The arch of the aorta. Okay, arch of the aorta. Fat tag denotes the arch of the aorta right here. Now what you want to observe on the arch of the aorta here is that in the chest it has two main branches or tributaries. The first one off of the arch of the aorta is called what? The innominate or the brachiocephalic artery. Why is it called brachiocephalic? Why? Because it goes to the arm, brachial, cephalic head. Okay. The first main branch here, the brachiocephalic artery, gives rise to what? you have right subclavian artery, right common carotid artery, and left common carotid artery. And what you want to know when you look at the common carotid artery, because it's so conspicuous, I want you to identify the vagus nerve. It runs in the sheath of the carotid artery, and what is this blue vessel called here? The internal jugular. So the internal jugular, the vagus nerve, and the carotids run in a common sheath. Here's your left carotid. Here is your left internal jugular. Alright, so, and then the third trunk behind the aorta. Oh, wait a minute. Let me finish the aorta arch here. Alright, so we have brachiocephalic. What is the next branch off of the arch of the aorta?
Left subclavian.
Left subclavian, thank you. Okay, and then proceeds on to the left axillary and then left brachial arteries. The third trunk, superior vena cava. Remember from our heart, what are the three main structures that empty into the right atrium?
Inferior and superior vena cava.
Carotid sinus, which we don't see very well, superior vena cava, and inferior vena cava.
What's the superior one?
Okay, so blood flow back to the heart, venous blood enters and fills the right atrium from the superior vena cava. On the back of the heart there'll be a coronary sinus right in here, see that? Bluish area right there. And then the inferior vena cava. Okay. Once blood enters the right atrium, blood will pass, generally speaking, passively by gravity. At least 80% of the blood from the right atrium passes into the right ventricle simply by gravity, gravitational pull. Over what valve? What's the valve that separates the right atrium from the right ventricle? Tricuspid. So, although we don't see a really clear example of the tricuspid here, we see at least one leaflet right here. See that? That's one of the leaflets of tricuspid. The main thing for your lab practical when I'm testing you is to know the location. So if you know where the right ventricle and the right atrium come together, then you will be able to tell me where the tricuspid valve is at. What are these little fibrous structures here that hold the
Capillary muscles.
No, the fibrous structures.
Chordae.
Chordae, see that? But you're correct. The papillary muscles are these sort of church spire-looking muscles. They're not very obvious in this section, but they have sort of a church spire or a, sort of a tent-like appearance. That's why they're called papillary muscles. What's the purpose of papillary muscles in the chordae tendineae? To hold the valves in place so that when the ventricles contract, they do not prolapse and we do not have backwash of blood. Alright, so from the right ventricle, where does the blood go next? Out the pulmonary trunk. Right here. Out the pulmonary trunk. Right here. What valve separates the right ventricle from the pulmonary trunk? No. Semilunar valves?
Oh.
Pulmonary semilunars. So then the blood passes from the pulmonary trunk through the lungs, comes back to the left atrium via pulmonary veins. So this way I would imagine right in this arena or area right here would probably be a couple of the pulmonary veins coming back to the left atrium. So now oxygenated blood is coming back from the right and left lungs through the pulmonary veins into the left atrium. From the left atrium, blood passes into the left ventricle here. This structure right here is the interventricular septum. It's easy to identify right and left ventricles when the heart is cut. Why? Right ventricle is about 1/3 the thickness of the left ventricle. You also can appreciate here a papillary muscle, chordae tendineae, and blood passing from the left atrium to the left ventricle travels over what valve?
The tricuspid.
No. Bicuspid.
Oh, yeah.
Mitral valve.
I'm
Mitral
calling out all
valve.
the wrong answers.
Alright, so once in the left ventricle, then blood does what? It travels through the aortic semilunar valves to the arch of the aorta. Over the arch of the aorta, then the blood will travel through the brachiocephalic and the left subclavian. From the brachiocephalic, you have the right subclavian, right common carotid, left common carotid. From the left subclavian, it gives rise to the left axillary and left brachial. Moving on to the superior vena cava now, which transports the blood from the head and neck back to the right atrium. Noting that the main portion of the superior vena cava located right here. This is called the internal mammary vein. There should be an artery in here, but I'm sure it's been nuked. But it goes to the breast tissue. Okay. Traveling up the superior vena cava, notice it bifurcates into two innominate veins or brachiocephalic veins, right and left. The brachiocephalics then give rise to what? Subclavian. Okay. Should be right. There it is. Right there. Subclavian vein. Right there. The jugular here. The jugular will then branch into the internal and external jugulars. The left innominate gives rise to left subclavian, external jugular, internal jugular. Notice this is a common jugular here. The internal jugulars then proceed upward to underneath the jaw, giving rise to the transverse jugular vein. Okay. I'm not going to ask you to know internal carotids or internal jugulars, okay, other than what I just showed you. If we look here for venous supply coming back from the above the diaphragm and from the intercostals here, notice there's a big vein right here, dumps right into the superior vena cava just before it enters the right atrium. This is called the azygous, or azygous, A-Z-Y-G-O-U-S vein. Okay? So now we follow the blood flow of the aorta through the chest, through the diaphragm, where it becomes now the abdominal aorta right here.